These are the stringent protective measures that medics in Liberia have to undertake before they can treat Ebola patients. As the ones who must get close up in order to treat them, they are particularly at risk of infection. But now, the fear of Ebola spreading to the wider community has forced the government to institute its own measures to protect the whole country. The president, Ellen Johnson Sirleaf, has ordered the closure of all schools, a thorough cleaning process for all public buildings on Friday, and 1 month's compulsory leave for all non-essential public sector staff.
It could be your community.
Speaking at a briefing by the World Health Organization last week, she emphasized how important it is for people to act responsibly.
It's real. Protect yourself. Listen to the health workers. Abide by the rules. Believe it is real. Go out and carry the message to wherever you are.
Ebola is transmitted through infected bodily fluids. If a healthy person comes in close contact with a sufferer, they are at risk.
The most efficient way it's transmitted is when people are taking care of people who are infected and they get directly exposed to bodily fluids, particularly vomit and blood and diarrhea and feces. And that's really the way things are happening right now and why we're seeing such an explosion of cases.
And that has prompted the withdrawal of 340 Peace Corps volunteers in Liberia, Guinea, and Sierra Leone. The possibility that air travel could help the virus cross continents is worrying Western governments. In Nigeria, health officials are monitoring those who came into contact with a Liberian man who died of Ebola in Lagos.
We've been meeting with the contacts based on the level of the contact they had, and we've been advising them on the very need for them to restrict their movement. And all of them have temperatures to monitor their body temperatures in the morning and in the evening. And then, of course, they all have phone contacts, and as well as our field surveillance officers monitoring the contacts.
But the man who first identified the virus in the 1970s believes that the risk of infection through casual contact is remote.
Spreading in the population here, I'm not that worried about it. I wouldn't be worried to sit next to someone with Ebola virus on the tube, as long as they don't vomit on you.
But in West Africa, this is the worst Ebola outbreak ever recorded, and 8 agencies say it is now out of control. Ahmed Idris, Al Jazeera,